Hello, my name is Ashley Sanders, and I'm a licensed mental health counselor in Florida. I've been working closely with schools for over a decade to provide educational mental health supports for students, develop wellness programs for staff, and ensure that mental health providers have the tools that they need for success. In this video series, we'll be learning more about solution focused brief therapy, or SFBT, including some of the most popular techniques and how to use them. According to Insoo Kimberg, one of the founders of solution focused brief therapy, this modality is based on the respectful assumption that clients have the inner resources to construct highly individualized and uniquely effective solutions to their problems. Solution focused brief therapy, or SFBT, has been a popular choice for use in education for many years, which makes sense since it is brief, solution focused, and evidence based for many presenting concerns. And it works well with students from elementary to high school. In this video, I'm going to provide a brief overview of what SFBT is and why it works so well in providing virtual school-based support. SFBT was developed in the 1970s and the 1980s by spouses Steve DeShazer and Insoo Kimberg with their team in Milwaukee. And since then, it has continued to gain popularity with clinicians due to its evidence based nature and how applicable it is to that variety of presenting concerns. But what is SFBT? Well, as we begin exploring it, keep these key points in mind. The most obvious one, it's brief and solution focused. Treatment often lasts only 3 to 8 sessions. In fact, each session can be approached with the idea that a second session may not occur. It is evidence-based and supported by research. Multiple studies have shown its efficacy in treating a variety of presenting concerns, especially as an early intervention. It is positivity-centered, where we look for the abilities and things that a client already has that will lead to success. In essence, we look for the wins. It is results-driven. It is present and future-oriented, rather than being focused on the past. One of the most important tenets in SFBT is that it is a collaborative process where we set outcomes and clients identify what personal things they are looking for. We will talk more about using the miracle question to do this in the miracle question skills section later on. In addition, keep these things in mind when using this modality. The client is the expert. If something is working, don't fix it. In fact, do more of it. And if something doesn't work, do something else. This modality fits really well in the school system, as mentioned, since it's so brief. The strength-based, solution-focused approach means that clients can find things that work for their concerns quickly. Additionally, since many schools do not have unlimited resources or funding for mental health, the limited session model of SFBT allows schools to help more students and staff within the constraints of their budget. Some of the many benefits of SFBT include being able to talk about problems without the risk of causing the client to relive the hurt or harm, since it is so future focused. It's also a focus on how they were successful in getting through the challenging experience, rather than a focus on how experiences have impacted them. The tools for success are easily achieved for school-based clinicians, as all that is needed to be successful with SFBT are relationships, hope, and expectancy. Next, let's take a closer look at questions in SFBT. After that, we're going to introduce you to some techniques commonly used in SFBT, and we're going to learn how to utilize them with your clients. You may be surprised to see how many of these things you're already naturally using. Many SFBT practitioners say that solution-focused brief therapy is about 2 things: knowing how to ask the right question and being curious. It is a questions-based process that encourages us to embrace curiosity without being nosy. We know that when people are experiencing difficult moments, their perspective shrinks, and it is harder for them to experience or see things outside of that shrinking perspective. In SFBT, the way to address the shrinking perspective and help clients find positive emotions and solutions beyond the difficult experience is through questions. Questions act as an invitation to a client. So remember, just asking that question is powerful. A client does not have to answer the question out loud for a change in perspective to occur. In essence, clients don't dismiss or fail to answer our questions because the questions are difficult. Rather, they are in a difficult moment that has created a diminished perspective. When using SFBT with clients, we need to learn how to ask the next question, not the right question. Take these steps to help you build this skill. Don't overthink your next question. As we mentioned, be curious but not nosy. When we are curious, we focus on desired outcomes, but when we are nosy, we are focusing on everything else. Work with the client to find the outcome. Once you know the outcome, tailor questions to that outcome by inviting people into the communication process. And this last one is really tough, but don't rescue people from the question. Let them do the work. The following sections will refer to more specific skills in SFBT. As you watch these modules, you will notice that questions play a part in everything we do in SFBT.